Here's the biggest difference between standard genetic testing and DNA sequencing. A lot of people don't understand that when their doctor is telling them that they're doing genetic testing for them, what they're actually doing is a very small panel of inherited mutations testing. They're looking at germline mutations, which is a very old approach to genetic testing that very rarely influences patient treatment in any way, shape, and form. It's just an easily accessible and cheap test that your doctor can offer you and say that they've done genetic testing, frankly. The issue is, again, it's not going to inform your care. It's certainly going to tell your family members if you might be carrying an inherited mutation that they then should get tested for, but frankly, why not just get your family members tested? DNA sequencing, tumor DNA sequencing, is specific to your cancer. You can have a blood-based version or a tissue-based test if you don't happen to have a biopsy or surgical remnant. But DNA sequencing is what tells us really important details like what mutations are happening, what genetic mutations are you carrying? What about mismatch repaired or MSI status? What about PD-1? Things that tell us about how well targeted therapies or immune therapies are going to work for you. If you haven't had at least like a 350 gene panel for tumor DNA sequencing and ideally 550 plus, that's how many genes we know of now that are specifically involved in cancers, over 550 of them. If you haven't had a test like that and your doctor's saying you either don't have markers or they've tested you or done genetic testing, almost certainly you are missing out on some very valuable treatments that would really make a difference for you. So make sure you get some good tumor DNA sequencing and don't just settle for standard germline testing.